Okay, Golden Flashes. Join me as we head over to meet with Dr. Deric Kenne of the College of Public Health, and then we'll meet up eventually with Dr. Ruoming Jin of the Department of Computer Science. And we'll find out from the two of them what's the big idea. Oh, there he is. Hey, look who's here. It's Dr. Kenne.
President Diacon, how are you?
So welcome to the What's the Big Idea? It's always a pleasure to see our faculty out and about on campus. I thought maybe we'd start out by talking about your project to track substance use in 3 Northeast Ohio counties. You have funding from the federal government to do your study and your work with Portage County, Geauga County, and Lake County.
Right.
Is there a reason specifically for those 3 counties?
Traditionally, a lot of prevention services are driven by data. The issue is that there's not always a lot of data available, especially in rural areas. So,
well, that's what I was wondering.
Yes.
Is the rural character of those 3 counties important and intentional on your all's part?
Yes, very intentional, because there's a lack of data in general, even in urban areas. So that's what we're trying to partially address with the project, is getting data available to these rural areas so that they can guide their prevention services without kind of anecdotal data or data that was from 2020.
So we've reached our destination, and we'll now head in and we'll talk to Dr. Jin and explore this further.
So this is the Healthy Communities Research Institute, where I'm just going to demonstrate the dashboard for you and let you take a look at it and introduce you to my collaborator, Dr. Jin.
Dr. Jin, it's such a pleasure to meet you. This is exciting work that the two of you are doing, and I look forward to seeing what you're collecting and what you're going to do with that information.
So what we wanted to do with this dashboard is provide a space for prevention professionals to access all of the data that they would need to drive their prevention efforts, right? So data-driven efforts. And so you can see along the left here, we've got all these forms of data that we're going to be feeding into the dashboard. And right now we have Twitter, or X, treatment claims, and alcohol or drug-related crashes, but we'll also have prescription drug information, emergency visits, so people who go to the emergency room for like a drug overdose or something related to substance use, death certificates, accidental overdoses, and arrest information. A lot of these data sources you could probably find on another website, like the state might have one or somebody else, and traditionally that's been an issue too for prevention professionals, because you have to know where everything is. You have to learn how to use the system, because every system's different. And so
you got to hunt.
Right, and we want to bring it all
for the various sources, and then you're bringing it all together.
Yeah, we're trying to bring it all into one place. We've even going to have census data in here, so if you want to know the demographics of your community, instead of having to go to U.S. Census and click and click and click, that information will be here and easily obtainable.
Some of that's pretty obvious, but when you say X, formerly Twitter, what's that about?
The computer scientists have developed a way to basically search Twitter as tweets are coming in. So anything that would have like a keyword in it that would refer to a substance, so alcohol or heroin or methamphetamine or something like that, gets triggered and gets counted in the Twitter data, and I can show you what that looks like. So this is all being done in real time. And then, like I was talking about earlier, there's a predictive aspect to this. So usually our dashboard is going to show the last 12 months of data, but then in the yellow is the predictive modeling that's happening. So the next 3 months, what we're expecting to have happen in terms of those trends. This stuff is also geolocated, right? So if we start to see kind of hot spots that are popping up where a whole bunch of people might be tweeting something, in like an overdose, right? Fentanyl overdose. We start to see kind of those hot spots popping up, and then prevention can go into those areas and start to intervene in those situations.
So I noticed that in the press release that you will, quote, incorporate deep learning, natural language processing, and data mining to track and assess substance use in these 3 counties. So really, really curious. Could you just give a layperson's explanation of deep learning, natural language processing, and data mining?
Like, we are building a neural network with thousands of layers, which was one of the major breakthroughs of artificial intelligence. But nowadays, this deep learning technique has been applied to natural language processing as well. Imagine the traditional way dealing with the Twitter data is always doing some keyword search. Since they basically collect a list of keywords, then just match which tweets have such keyword. But you can imagine the same keyword, even one, we always say, like say bank. It just have so many different meanings.
Right.
You have no way it's a real bank or something else.
Yeah.
A lot of it's just false information. So in this project, we can actually identify those tweets are really about.
They really are about.
Really, people talk about drug abuse, which is a very rather lengthy process. The recent natural language processing like deep learning really helped that.
This has been a really interesting discussion of your work. I really appreciate the interdisciplinary nature of it. As I've said before, I appreciate your bringing in undergraduate and graduate students. And as we finish up, I feel like we should rename this "What's the Really Big Idea?" because this strikes me as just the personification of what we want to do as an institution, which is generate knowledge, teach students, but also make our communities better and stronger. And I think you're doing that in this work, and really appreciate it. It's been fun to talk to you about this work.
Thank you. Appreciate it.
Thank you.